Welcome to What You Need to Know About the ACA. My name is George Goss. I'm the CEO of Spring Insurance Group, and this is for the week of August 11th through 17th of 2014. These ACA updates will give information to you and your employees that will provide excellent strategy and updates that can help you with your employee benefits and overall employee benefit spend. An update that came out last week was from the IRS, the Internal Revenue Service, concerning the threshold for determining whether an employer has offered quote-unquote affordable coverage to an employee. In the past, the percentage was based on a 9.5 test, and that test amount, or the percentage amount, is going to be going from 9.5 to 9.56% as the mandate is phased in. So if an individual, an employee, spends more than 9.56 on their health insurance plan cost, and I'll go through what that means, and it's considered unaffordable if you go beyond 9.56, and therefore they may be eligible for subsidies through the exchanges. So let's talk a little bit about that. Basically, an individual has to look at a couple of different factors, and usually what happens is that the plan administrator and the broker would work together to help come up with a spreadsheet basically outlining what the cost would be. So you take what the employee's income, annualized income is, and it's divided by the number of, by the cost to the employee based on the lowest cost plan offered by the employer. So for instance, if you've got two plans that you're offering, one is a low and a high, the mandate focuses on the lowest cost plan offered, even if you're on the higher cost plan. Then you only focus on the individual portion of the premium. So if a person is on a family plan or a two-person plan, it's only based on the individual portion of the lowest cost premium offered by the business. That's the test. And you take what the contribution is by that employee. So if the business offers 50% for an individual, you would put in, for a $500 premium, for the lowest cost premium, you would put in $250. You would annualize that as well. So the annualized contribution for that employee divided by into what their overall annualized premium is, annualized salary is, would give you a number. If it's over 9.56%, it would be deemed unaffordable, and again, it would kick off an opportunity for the employee to go and look for insurance options through the exchanges, and the employer would therefore be out of compliance. Keep one other thing in mind. It's based on a 30-hour per week employee. So if you've got an employee that gets insurance through the office and they work under 30 hours, it doesn't apply to them. This is for 30 hours or more as the mandate. And you can set up, we'll work with you to set up what we call a 9.56% test to see if you're in compliance or not. And it's applicable to companies with 50 or more insured. So that's another threshold. A lot of businesses have asked us, you're running this analysis and our company only has 40 eligible employees. Why should we do this? Well, we'll get into it on the next slide, that there is a shortfall already as part of the ACA, and that they're already contemplating going below the 50 threshold in terms of the number of insureds. What that means to you is, for a business perspective, you want to make sure you understand exactly where you stand for your individuals and whether you're offering quote-unquote affordable coverage or not. And do you want to make some adjustments on a strategic level on either increasing their pay to get these people into compliance, or would you want to look at altering your health insurance plan that you're offering? Either way, you want to do some pre-planning to make sure that you're ready in the event that businesses would go under, the threshold will be under 50. Keep in mind, too, your business may change during the year from, I mentioned that company that's 40, may go to 60 or 70. Therefore, you would want to understand what the implications are and the ramifications are of making such a change, and how you would fit under the new higher enrolled number on your health insurance plan. Additionally, the IRS also adjusts the individual mandate, the threshold of household income, that cannot be exceeded for a plan to be considered affordable from 8 to 8.05%. That's a different calculation, but it gives, because of the increases in the insurance, they had to adjust accordingly for both of these measures. This is the current timetable for the employer mandate. The employers with 50 to 99 employees must offer affordable health plans, and I can almost put that in quotes, affordable health plans to at least 95% of full-time employees by 1/1/16. So keep in mind that affordable is the affordability test, the 9.56% by 1/1/16. Employers with 100-plus employees must offer affordable health plans to at least 70% of full-time employees by 1/1/15, and by 1/1/16, during that year, they must offer affordable health plans to at least 95% of their full-time employees. Significantly more people are qualifying for individual mandate exemptions than expected, and this is a real problem. It's a good thing if you're an individual, but from the federal government's perspective, to help fund the 7 to 8 million people that are now being funded by the ACA, there's got to be a way to pay for this. And they were hoping that people would not have as many exemptions. The more exemptions, the less revenue that they can collect. So the estimates for non-exempt individuals, original estimate was 4 million. The new estimate is, 7 million. The new estimate is now 4 million. That is going to result in a revenue drain. Penalties for non-exempt uninsured individuals, you see the timetable, they're not very much in the first year, $95 per adult or 1% of taxable income. And then it grows in year 2 and 3. The Congressional Budget Office estimates the shortfall currently at $3 billion. This number could increase considerably, and they are very concerned about that. Therefore, they're going to be looking to crack down and enforce a lot of these mandates, such as the ones we talked about in previous slides. That they're looking at thresholds, they're looking at penalties and fees. If not, increase in exemptions is to blame for decrease in non-exempt individuals, and premiums are likely to rise in order to make up the difference. There's got to be a way to come up with the money to offset this this shortfall. This is just one of the things that they're looking at doing. The concern is that for fully insured businesses, typically under 100 in size, that there could be additional taxes and fees levied, a collection of these taxes and fees where in the past they weren't doing as much, and they need to do that. And then the third thing is, will the underwriting be a little bit more loose, which would result in higher premiums just to counter any potential fees levied, additional fees levied by the ACA, and the potential of more and more people in the marketplace not getting insurance. So that's just a quick update. Again, Spring is looking to provide these updates on a weekly basis with different topics, and we will give updates to you real time as possible, and as changes come, we will provide this information to you, and we look forward to meeting with you each week to discuss these.